Hi everyone and welcome to today's webinar. Thanks for joining. Today's session is about how GP practice social media can power public health campaigns. I'm Cameron Booth and I'm joined by my colleague Paul Galley. And this is essentially a conversation on bridging GP reach and public health strategy. Just going to turn my camera off while we go through the presentation. Feel free to ask any questions in the chat and we'll answer those as we go if we can. In terms of a session brief, public health teams are under pressure to deliver targeted, high-impact campaigns, but many are missing a vital asset, which is trusted, high-traffic GP practice social media channels. So Redmoor Health currently manage over 850 GP practice social media accounts across the country, with content reaching millions of patients every month. We've got a program called the Social Media Managed Service that all of this is running through. So that's where we'll be speaking from in many ways today, given our experience and network. And we're going to, in this session, explore the untapped potential of GP practice social media in general, as well as the network that we've got to support local health priorities. And we'll talk about an offer that we can make to you later on in terms of, connecting in with us and those accounts that we manage. Today, we're going to look at what types of content patients engage with from their local GP, how local health messaging can be aligned and amplified across existing practice networks. We'll look at some ideas for joined up campaigns, co-branding and community engagement as well. And then also how public health teams and ICBs can explore early collaboration opportunities. This is an open session for local authority comms teams, practices, ICBs and public health leads looking to explore smarter ways to get messages seen and heard. So there's a clear public health communications challenge in today's system, which is the increased pressure to deliver more targeted and higher impact campaigns. Public health teams face increasing pressure to deliver results as well. The challenge isn't just about getting messages out, it's about getting the right messages to the right people at the right time. And unfortunately, many teams are operating in silos, missing the opportunity to tap into practice networks. There's a lot of limited time, funding and media channels also causing barriers. So we'll look at that today and see what can be done about it. There is an untapped yet highly effective channel available. It's often overlooked, but that is general practice social media. Practices are already communicating with patients via social media at scale. So they're already doing it across the country. And these platforms are active, engaged, they've got loads of followers, and they're seen as credible sources of health advice already by most practices across the country. It's unfortunate, but they remain often underused by public health teams who could benefit from this reach. Again, these accounts are highly trusted by patients, especially being within the NHS brand. There's also national campaign guidance that can be lent on. So we'll look at some examples of that today as well. So Redmoor Health, as mentioned just before, we've got a fully managed social media service. We currently support hundreds of practices across the country. The programme is essentially designed in a way to help practices to get set up with and using social media, but without the burden of building and maintaining a consistent, high-quality presence on social media. Our strategic and also expert-led approach ensures that key messages and content reach the right audiences with impact and meaning, whilst enabling practices at the same time to focus their internal resources where they're needed most. Over the last 12 months, here's some of what public health campaigns have achieved on the SMMS, or the Social Media Managed Service. We've got 850 accounts managed, actually more than that now, which includes mainly Facebook, but many Instagram and X accounts as well. There's 330 plus thousand followers. We reached 51.5 million people this year with campaigns, 3.7 million engagements, so likes, comments, and shares. So really, really powerful in terms of ability to get messages out to a very unique audience, which is, as I guess we all are in many ways, but it's specifically around NHS patients that view this type of content with a health focus. Just to give you an idea of what's possible for a single practice to achieve on social media, Bay Medical Group are a fantastic example. They're up in Morecambe near me, and they are on Facebook, Instagram, and X, but most of their performance figures are taken from Facebook. Feel free to check them out. You'll see plenty of posts going out. We actually set them up on social media about 4 years ago from scratch. They do post largely their own content now because they've got such a big audience. So it doesn't always look very well designed, but you'll find a really high amount of posts, engagements, etc. But I just want to bring your attention to the reach that this practice has been able to achieve. So it's a large practice. It's a dual practice PCN. So they've got a large patient list size. But in January of this year, they've got 6,500 followers on Facebook, and then another 1.25 thousand followers across Instagram and X. But those patients that follow them on social media viewed the content that they shared in January alone over 290,000 times. And we get that from the directly from Meta, those figures. So, and that's not impressions. Impressions is like the times that the posts have popped up on people's feeds, which is a much higher number than that. A reach is somebody that has actually taken the time to view those posts. So, they've got a really high number of people viewing the content every single month on social media, interacting with their content. They've got 21,000 engagements in the month. Again, likes, comments, and shares. So social media for that practice has become a really dynamic, far-reaching patient comms tool that they didn't have before. It allows them to send messages much more instantly. It's free, and it's just something that they can now use for all sorts of communications on their page as well. So why do GP channels work? Well, again, just echoing what I said before, the trust that patients place in their local GP can't be overstated. It's the ideal platform for distributing public health messaging, especially when national campaigns feel distant or impersonal. Messages coming directly from the GPs on social media do particularly well as well. So, for example, posts with pictures or videos of doctors and nurses generally have really high engagement rates. And that's also true because practices are sharing very consistent messages on their accounts. So every single week, they're sharing multiple posts, updates, advice, population health messages, local announcements, and that's helping patients to resonate with, connect, and anticipate messages from their practices. It's also, again, really good in the ability for practices and public health to reach the right person with the right message at the right time. So imagine when there's an outbreak of an illness, or there's an extreme weather event, or there's something that's happening locally in the news. You can put messages on about them topics, and because it's relevant, it's timely, it's just allowing practices to pivot, and not only on a local level but on a network level and even a national level, utilize these accounts to get public health messages out in a way that is meaningful and it's very relevant. So we often find these types of posts doing particularly well as well. Here's some example campaigns just to give you a flavour of what's being shared on social media in general practice. So this is an Instagram post. It's a nice, simple visual with a catchy headline to get people's attention, and then some more accompanying text in the body of the post. So you can also put website links, emojis, hashtags to bring the post to life, just putting more information about this quite generic population health message about eating disorders. Or it could be about sleeping habits, again, an Instagram post, just nice, simple imagery, especially on Instagram where it's a more visual platform, alongside some more detail, especially when you've got local services or different bits of information to share about how that ties in with the practice service provision or the local service provision. You can take national campaign assets from the content library available at NHS England, also just sharing content actually that they've already got on their Instagram and Facebook accounts. And you can also share, if there's an app or there's a local service, there's just anything that you feel could benefit patients. These types of posts are really good to put on. These types of posts are much more generic. They apply to all patients. So really, it's just about keeping pages lively with plenty of these more generic messages alongside a healthy blend of more local, personable, practice level content. So anytime there's an important announcement, technical issue with the phone line or the website, or there's a member of staff joining or leaving, or there's a new clinic in the diary, there's a new walk-in centre, etc. It's about sharing a healthy blend of the more generic, national population health level stuff alongside the practice level stuff as well. And importantly as well, we've learnt that patients engage the most with the more relatable, helpful human content. So whether it's advice on staying cool or it's celebrating long-serving receptionist, these types of posts connect with the community. So it's about having that personality threaded in with the content. As I said, this is the most engaged type of content. So people actually take the time to like or comment on these posts. It doesn't mean that the other posts aren't valuable. It's just that people will just view that content as opposed to engaging with that content. So we do encourage practices at every opportunity, at least once or twice a week, to think about, are there any things that they can share about, their staff, their building, their community, anything that's been done for charity? Is there any human stories that can be threaded into the content? Because that will go a long way, especially when you tie it into the health journey of the patient. So as an example, this is a flu campaign that we ran on Bay Medical Group's social media not too long ago. And this simple, personable post, it's just a picture basically with some accompanying text, reached hundreds of thousands of people within a couple of months. And it had a really significant impact in the uptake of those flu vaccines. It was the record year this year because they've said these campaigns did so well. It shows the power of digital engagement, even for routine seasonal messages. Posts don't always need to be fancy graphics. It can just be a simple picture. But we actually also shared this campaign in some local community groups around Morecambe. So, for example, Armed Forces or Cancer Care or a volunteer group, for example. And over the month of December, it actually reached an additional 167,500 people within those groups. So for messages that do need to get out much further and faster, that's a really good method to do that, alongside what we call boosted campaigns. So for those that haven't heard, you have got the ability on Meta, which is the parent company of Facebook and Instagram, to pay for advertisements. So Normally, posts on practice social media accounts will only be viewed by existing followers or patients of that practice. If you want messages to go out much further and faster, what you can do is put a little budget onto Meta, maybe a couple of pounds per day as a practice. You can target people within a search radius of the practice. It could be a particular gender or age or ethnicity, any sort of demographic really you can be very specific on for targeted campaigns, or you can be less specific as well. And you can reach those patients additionally as well. So you will see exponential increases in reach and often engagement by running boosted campaigns. They are often very cost effective. Practices don't always need to spend a lot of money to get good results. A practice might want to run a boosted campaign to get new patients, so they want to increase their patient list size. And we also might have an ICB wanting to deploy a boosted campaign to reach people within their locality. Doesn't need to just be the followers of the practice pages. It could just be across the region. They want to get very specific, high priority messages out. In terms of some community engagement ideas, social media works best when it feels two-way. So we encourage interactive content that not only informs but involves the public as well. It builds relationships and increases attention to future health messages. So on posts where you feel like there could be more personality included, just think about maybe putting some polls, or might be some music, or prompting patients to give feedback. It might be a Q&A on myth busting different health topics with local GPs involved. We've got so many examples of this type of content, especially on platforms like Instagram, using the reels and the different types of content features, are doing incredibly well. So it's a really good way to build engagement. We've also got examples of practices using things like Facebook Live to live stream PPG meetings, or members of their team doing Q&A on a health topic such as COVID. And again, that type of content is really good in prepping people for future messages, but also just providing that extra layer of engagement on content so it's not boring. You can also use comments to engage with the public. So if there's a post about, for example, a smear test, that's a good opportunity for people to ask questions, you to answer them questions, and those answers to be visible to other patients so that you don't have to, keep on answering the same question. People often put really good feedback on especially nice posts that have been shared by practices. So it's just, again, another way in which not only practices but public health teams can be more involved and to build up that rapport with people online. There is a level of managing negativity that needs to be paid attention to, because some patients do voice negativity on social media. It doesn't always need to be deleted. It's sometimes healthy to have some comments about issues with the phone lines, or maybe a service that was on offer wasn't particularly valuable. But there are some instances where there's swearing, or sometimes a member of staff has been named, where we will hide those comments from the practice pages. We do generally as well turn off the ability for patients to be able to direct message practices on social media, or to tag them in personal posts or write reviews. But it's dependent on if the practice wants to enable that or not. But just so you're aware, there is an additional layer to engagement on the comments. As part of our social media managed service, we also use advanced AI video software to create bespoke, personable content that's tailored to each client. So this technology allows us to bring messages to life by using either existing avatars of generic GPs or creating new ones based on real staff members within an organization. They look and feel exactly like the member of staff that you create the avatar for, only that, once you've created the avatar, the GP doesn't need to do anything. You can just continue to give it scripts and video prompts and everything to bring the videos to life. So it adds a real human touch to digital communication. We've had fantastic patient feedback on this type of content that's been shared over the last few months on our service in particular. And we've got the ability to produce content in any language and customize, again, the backgrounds. We ensure that every message is both culturally relevant and visually engaging. So it's perfect for reaching diverse audiences across different platforms. So just think about this from a public health perspective, how messages could become much more powerful and meaningful using people within the community that they know and trust, but without the staff needing to create videos of themselves all the time. We just create that avatar again and then give the avatar a script and add music and background and text and everything. And it's just a fantastic way to make content much more dynamic and versatile. It's also possible to I'm just going to share, sorry, the example of this avatar, so bear with me. Cool. We've got loads of different examples of these avatars. That's actually not the best example. I've just realized that that example is his hands are quite rigid. It's still a good example, but we've got other examples where, the avatar really looks like they're alive with the hands moving and, different movement cues that they've employed as a software. So really powerful for those messages to go out. It's also possible to amplify your message further by coordinated campaigns across networks. By aligning messages across multiple practices, a regional voice becomes consistent and credible whilst still feeling local. So we can basically share the same message or type of message across tens or hundreds of pages at once. We can also use pre-made templates that are tailored for local needs with different color schemes and branding involved, and reinforcing NHS-wide messages with local relevance. Also think about co-branding on some campaigns, because when we co-brand, the message is stronger for more local messages in particular. The public, they'll see familiar branding, such as their ICB or a public health body, council, etc., alongside their trusted GP voice. We've supported campaigns like diabetes prevention, cervical screening, and childhood immunisations in this way, and we've done that for a very long time. You can have, for example, branding from a local service that's available to patients alongside the ICB and or NHS branding, just to make the message clear on where that service is available and also add the credibility to the post itself. So we actually did a campaign around diabetes in a patch of practices that we support. I've had to remove that branding from the ICB branding from this example post, but we shared it across 20 practice pages that we manage, and it reached 31 people within a week, 31,000 people within a week. And it was really powerful in increasing referrals as well. So it's just an example on how you can essentially just put multiple logos together on the same post just to add that credibility. And also, I just want to talk about our work with Norfolk and Waveney ICB, because this has been really powerful over the last year in particular. So in late 2023, the Norfolk and Waveney Integrated Care Board, or ICB, they recognised the need for a cohesive social media strategy to improve communication with patients across their network of GP practices. So they commissioned the social media managed service to oversee and manage and set up the 63 practices that were wanting to join the programme at that time. And the aim was basically to enhance patient engagement and communications, to promote essential healthcare services, and importantly, to drive the adoption of digital tools like the NHS app. So in November of 23, we started doing targeted NHS app campaigns across the 63 practices that we managed, all about improving registrations and utilization of the app. The campaign leveraged a variety of digital content, so informative posts, how-to guides, patient testimonials, videos, highlights, etc., just showcasing the benefits of the NHS app, such as easy appointment bookings or prescription management or access to medical records, for example. And the campaign achieved remarkable reach and engagement. So we reached millions of people within 6 months, and the widespread exposure translated into a significant uptick in registrations and active usage, which demonstrated clearly the effectiveness of the campaign in driving patient behaviour. There's some key performance metrics that we've achieved between that time period. So there was a 25% rise in the average monthly appointments booked post campaign, so just after 6 months, which indicated heightened patient engagement. There was a nearly 8% growth in registrations, which accelerated the adoption of the digital healthcare tools available in the area. There was no other real initiative taking place at the time, so the ICB have said that was a direct result of the social media campaigns. There was also a 33% increase in appointment cancellations, which is really valuable, obviously, for reducing DNAs and getting people to take the initiative to use the digital tools. So people are actively managing their healthcare and their appointments on the app. We were actually HSJ finalists last year for this piece of work, which really highlighted the impact of ICBs and different health bodies shaping local social media campaigns. I'm just going to pass you over to Paul to talk about the Just Talk stuff as well as some of the collaboration that we've mentioned.
Thank you, Cameron. So good afternoon, everybody. My name's Paul Galley. I'm creative director at Redmoor. Bit of background on me. I've been at Redmoor for around about 4 years now. Prior to that, I've been creative agency. I've been in that world for pushing nearly 30 years now, which makes me feel quite old. What I'm going to do in this section, I'll just talk you through a bit more of a deep dive in terms of what we've done with the Just Talk team over in Hertfordshire. So I'll just take control. So we first started working with Just Talk around about 4 years ago now. In terms of background on Just Talk, they're a multi-agency program steered by young people which supports signposting services for emotional well-being. The Just Talk website contains lots of useful information and advice for young people, parents, carers, and professionals. So, the very first campaign we looked at was just coming out of the pandemic. And what we were looking to do is target children and young adults that were negatively affected by COVID. So, during the pandemic, there was an increase in people, particularly young people, who had seen their mental health deteriorate. And there was a perception that the mental health services were unavailable. And this campaign was aiming to tackle that and show that the services were open and accessible. The aim was to drive traffic to the Just Talk webpage and increase social media engagement. The targeted digital adverts were posted across social media channels, including Facebook, Instagram, and Snapchat, signposting people to where they could access help. As well as the adverts, we created digital toolkits, which included templates and imageries for all partners to use, particularly for hard to reach groups and those with protected characteristics. It had a huge success. It resulted in 10,000 hits on the site, and that was just within 4 weeks. We continue to work with Just Talk. We've done numerous campaigns with them over the last few years, covering topics such as body image, exam stress, online safety, and the power of small change, just to name a few. So with each campaign, they get their own look and feel, so that we're having a differentiation from what came before, so it has its own life. But then with each one, there is a tie back to the brand. And in each of those, there's just some statics you can see there, but in each case, we did animated assets that get more cut through, especially on Instagram and platforms like that. And each campaign, after we've run them, we then run the reports, which are quite crucial because they feed back into how we shape future campaigns, the planning behind that, ensuring that messaging is resonating and continuing to grow the social media engagement. An important point to make here, I think, is that especially with Just Talk, the young people of Hertfordshire had a huge influence in the campaigns. And this co-production really resonates with the target audience because they kind of see a bit of themselves in the messaging. So the key takeaway there is, how does your audience speak and what language do they use? And I don't just mean whether that's English or not. I'm talking more colloquially. So in a kind of a basic example would be, is your audience going to say vaccine or actually will they say jab? It can be as simple as that in some instances. So just to summarize, the best results happen when collaboration starts early. Planning together allows you to shape your content that meets both public health priorities and GP communication style. And that's why at Redmoor, we have regular meetings with all the practices we work with and at ICB level to help shape that quality local messaging that will resonate with patients. And then just a final thought from me before I pass you back to Cameron. Whilst the focus of this webinar is social media, I think it's worth considering that there are other channels of communication that can be used, especially if you want to focus communications to patients that are maybe not digitally savvy or social media users. So if I just make it personal for a second, if you look at my parents, so both my parents are in the mid-70s. My dad is very, very digitally savvy. He has all the gear. He's got, the latest iPhone, the latest iPad Pro, the latest MacBook Pro. I mean, I'm literally seeing my inheritance kind of lessen each time he buys a new device. But the thing that he isn't is a social media user. Same with my mum. She's not tech savvy. So it's always good consideration that there are other ways to get a message through. So you can have the same message that you're posting on a social media campaign, but maybe just have that also distributed in leaflet form or flyers within practice waiting rooms. It's much more likely to gain cut through with a particular audience and much more likely that that message would end up pinned to my mum and dad's fridge door. That's it from me for now. I'll pass you back to Cameron.
Thanks, Paul. So yeah, just on Paul's point as well, just to also mention around this, it was about increased followers. I just wanted to quickly mention as well that the campaigns that we share on practice accounts do a lot better the more followers that the practices have. So we do put in work to help them to get those additional followers. So we'll give them a poster to put on the reception desk with a QR code on it, just helping people quickly and easily identify and follow social media accounts that are available. Putting something on the website, or sending out a batch text message saying, please follow us. So some practices have done that and they've got 500 new followers in a day sending out a batch text message. So it's a really powerful way to get that following up. But it's just to say that, you know, the reach and the effectiveness of social media, especially from a public health perspective, is amplified when those followers are as high as possible. If today's ideas and presentation does spark interest, let's have a conversation. So you can email me later on and we can book in some planning sessions where we can explore some campaign options and look at some potential strategies for you to identify and connect with practices in your area, or looking at some themes and timelines and resource needs, content planning and mapping. It's just always good to have a conversation, because that's where often people link things together and start putting action in place. So just to wrap up, the opportunity is real and the tools are ready. With GP social media, we can reach millions of patients where they already are, which is, you know, followers of these accounts. And we can do so in a way that builds trust, visibility, and better health outcomes as well. So it is an underused but really powerful tool. We can coordinate content and we can collaborate with different bodies and make sure that we use content that's tactically created in a way to make the engagement and the meaning of posts as good as it can be. So let's open it up. Are there any questions? Also, if you've got any ideas of campaigns that you're working on that could benefit this approach, please do share that with us. And are there any challenges or any ideas that you've got? And we can have that conversation. So I will just enable your camera and microphone. And feel free to additionally pop your questions in the chat as well. But that is the end of the session. I do hope you found it really useful. If there's any bits that you feel like we're missing, please do let us know about those. But feel free to turn your microphones on or to pop some questions in the chat. We can go to some slides if you want to look at some of those examples again. Let us know what your thoughts on the session were, and if you've got any questions or you've got any ideas for campaigns or challenges. But for those that do want to jump off already, feel free to do so. I'll just pop my email in the chat as well if you want to send me an email. We got a question, Amelia?
Hi, thank you. That was really interesting. I had one question about the AI videos. You said that they can be that you could use translations in the videos. How is that quality assured to make sure that the desired messaging is still being sent out in the various languages?
Yeah, it's a really good question. We actually work with lots of different practices that have got hard to reach groups of patients. We manage practices, for example, even in Wales, you know, plenty of accounts there, or it might be even languages that don't have often translatable software. So Urdu or Urdu, however you say it, is a really notoriously difficult language to get that type of content for. Or it might be Polish, it could be any demographic. So what we ask practices, if they have got target patients if they've got members of staff that we can vet the content with first. So that we sort of avoid the risks of that. There was an example where there was a campaign that we wanted to share on some Welsh practices pages, and it was about cervical screening, and the translation had said it was mouth screening. So very, very important for that word to be correct. But what we do is each time is the onus is essentially on the practices. If they've got generally a hard to reach group of patients, often they'll also have staff or people that they can send the content to first just to verify it. So because the hard to reach groups, I mean, my wife is German and she says that every time we've done German translations, it's near perfect. It actually is perfect. She said that she can never fault it. So generally, the more commonly spoken languages are appropriate to use the content, but we do often just run it by the practices. But especially with them really hard to reach groups and the difficult languages to translate, we do just run it by people. But the benefit is that we're not often posting them types of messages. It's really just on specific, really important messages, especially about services that the practice wants to get in front of hard to reach groups of patients. So there's a blended approach. Sometimes where we work with an ICB on these types of campaigns, we're able to work with people within the ICB that speak that language, but it just depends, to be honest. We don't share anything without being sure that that is the language, the appropriate language. But it just depends on who we're working with, what the language is, if you're using AI or we're just using some of the other language translation tools available. But if you've got anything in mind, we can certainly have a conversation about what that looks like. Really appreciate your time, and thank you for joining. Thanks for Paul for presenting as well, and we'll send a follow-up email with the slides and everything, and with a website you can check out the example AI video, and I'll send you my email, and you can send me an email directly if you'd like to have a meeting set up. But feel free to leave the session. Thank you so much for joining, everyone, and enjoy the rest of your day.